Did you know that ensuring your baby receives enough vitamin K can be a matter of life and death? Vitamin K deficiency is a serious concern that requires attention and proactive measures. Are you familiar with the signs and symptoms of vitamin K deficiency? And how can you ensure your little one receives the necessary care to prevent complications? Let's explore this critical topic together and empower ourselves as caregivers. Welcome to Vitamins, your ultimate guide to holistic health and wellness, offering expert insights and practical tips for optimizing your well-being. As a quick medical disclaimer, the content we offer is for informational purposes only. Please consult with your doctor for any questions regarding vitamin or supplement consumption. Now let's get started. You know, vitamin K is like a caring guardian angel in the world of newborns. It's as if there's this gentle presence that embraces their fragile existence, just like a warm, protective cocoon around a delicate butterfly emerging into the world. Picture it like a ray of golden light, infusing their bloodstream with the strength of 1,000 warm hugs. It's there to ensure that their precious life essence flows with tranquility and reassurance, like a peaceful river guided by this loving force. Vitamin K deficiency in newborns is when these little bundles of joy don't have enough vitamin K to properly clot their blood, which can lead to uncontrollable bleeding. You see, newborns don't get a whole lot of vitamin K from their moms through the placenta or from their own livers. Their tiny tummies aren't quite equipped to produce enough of it either. Even the levels of vitamin K in their formula or breast milk, also known as chest milk, can be on the low side. That's why it's more common for newborns and infants who don't receive a vitamin K shot to experience this deficiency. It tends to affect babies up to about 6 months old. Bleeding caused by vitamin K deficiency can be quite sneaky. It often happens inside their little bodies, affecting their internal organs like the brain. As you can imagine, this can be really tough for parents or caregivers to spot. But when bleeding occurs in a newborn's brain, it can lead to serious brain damage and become a life-threatening situation. That's why it's important to be aware of vitamin K deficiency and take steps to prevent it in these precious little ones. Did you know that vitamin K does wonders for our bodies? It has a few key roles that are truly impressive. Firstly, it plays a vital role in wound healing, ensuring that our bodies can effectively repair and close up those pesky cuts and scrapes. Secondly, it contributes to building strong bones, helping to keep our skeletal system sturdy and resilient. And here's another fantastic benefit. It's believed to have protective properties against heart disease, keeping our cardiovascular health in check. Now let's talk about where we can find this amazing vitamin. Nature has generously packed it into a variety of leafy green vegetables that are as vibrant as they are nutritious. Just think of spinach, cabbage, kale, collard greens, broccoli, Brussels sprouts, and lettuce. These green goodies are not only delicious but also rich sources of vitamin K, providing us with the goodness our bodies need. Moreover, our own bodies are quite the vitamin K factories too. It turns out that certain bacteria residing in our intestines help produce vitamin K for us. So, in addition to consuming those leafy greens, our internal microbial buddies lend a helping hand by creating some vitamin K magic right inside us. It's a fascinating partnership that keeps us well supplied with this essential nutrient. When it comes to vitamin K deficiency, the main symptom to watch out for is uncontrolled bleeding. However, there are other more subtle signs that can also indicate a deficiency. These may include sleepiness, vomiting, seizures, bruises, especially on the head, petechia or little red spots, nosebleeds, jaundice, pale skin, and stool that is bloody, dark, and sticky. The root cause of vitamin K deficiency lies in a lack of this essential nutrient within your baby's body. Let's explore the various factors that can contribute to this deficiency. 1. It's possible that your baby wasn't able to acquire enough vitamin K during fetal development. This can happen for various reasons and may impact their initial vitamin K levels. 2. The absence of specific bacteria in your baby's intestines can hinder the production of vitamin K within their own body. This natural process, which takes place in the gut, may be disrupted, leading to a deficiency. 3. Certain medications taken during pregnancy, such as phenytoin or isoniazid, can affect vitamin K levels in the developing fetus when exposed to the uterus. 4. Liver disease is another potential cause of vitamin K deficiency. In cases where the liver is impaired, the effectiveness of vitamin K can be compromised, leading to inadequate clotting ability. 5. Poor absorption of vitamins can contribute to a deficiency. Conditions such as diarrhea, celiac disease, or cystic fibrosis can interfere with the body's ability to absorb essential nutrients, including vitamin K. If you've been enjoying the content so far, we'd greatly appreciate it if you could show your support by giving this video a thumbs up, subscribing to our channel, and sharing your thoughts in the comment section. We value your feedback and suggestions for future topics to cover. Now let's get back to the rest of the video. Let's shift our focus to certain risk factors that can increase the likelihood of vitamin K deficiency in your baby. Here are a few factors to be aware of. Firstly, if your baby didn't receive the vitamin K shot at birth, they are at a higher risk. In fact, infants who do not receive this shot are approximately 80 times more likely to develop late vitamin K deficiency compared to those who do receive it. Secondly, if your baby is exclusively breastfed or chest-fed, they may have a higher risk of vitamin K deficiency. Breast milk, while rich in many nutrients, does not typically provide sufficient levels of vitamin K to meet their needs. Additionally, exposure to certain medications that can cause vitamin K deficiency as a side effect can pose a risk to your baby's vitamin K levels. It's important to be aware of any medications being taken during pregnancy or given to your baby after birth. Alright, let's talk about the potential complications of vitamin K deficiency. It's crucial to recognize that this deficiency can be life-threatening for your baby. Uncontrolled bleeding can lead to severe consequences such as organ failure, seizures, and even coma. If you notice any signs or symptoms of uncontrolled bleeding in your baby, it is of utmost importance to call 911 or visit the emergency room immediately. Prompt medical attention is essential to safeguard their well-being and prevent further complications. Now, how is vitamin K deficiency diagnosed and treated? It's fascinating how healthcare providers use their expertise to address this condition. When it comes to diagnosis, your baby's healthcare provider will delve into their symptoms, medical history, and birth history to gather essential information. It's like piecing together a puzzle to get a comprehensive understanding of your little one's situation. They may also conduct a blood test called the prothrombin time test or PT to assess how well your baby's blood is clotting. It's amazing how these tests provide valuable insights into their clotting ability. For the treatment, envision a caring healthcare provider as a skilled artisan delicately weaving a safety net with an injection of vitamin K, known as phytonadione, for your baby. It's as if their hands are guided by an invisible force, creating a shield of protection. This injection is like a key that unlocks the body's innate ability to clot, safeguarding your little one from harm. Administered into the muscle on your baby's thigh, it ensures that the healing power of vitamin K permeates their system, fortifying their defense against the perils of uncontrolled bleeding. Sometimes, depending on your baby's test results following the first injection, they may need additional shots to bolster the vitamin K levels. It's like fine-tuning the treatment plan to meet their specific needs and ensure their optimal health. In rare cases where severe symptoms are present, more intensive measures may be necessary. This can involve blood and plasma infusions, and in some instances, surgery may be required. These interventions, orchestrated by a dedicated medical team, aim to provide the highest level of care and support for your little one. In conclusion, vitamin K deficiency in newborns can lead to uncontrolled bleeding and complications. Prompt diagnosis and treatment with vitamin K injections are crucial. With the diligent care of healthcare providers and parental involvement, we can ensure the well-being of these precious little ones affected by this condition. Let's prioritize vitamin K awareness to protect their health and future. Have you ever heard about vitamin K deficiency in newborns before? What steps do you think can be taken to raise awareness to prevent this condition? Unlock the path to a healthier you and join the conversation by sharing your thoughts in the comments below. And if you want to dive deeper into the topic of vitamin K deficiency and expand your knowledge, we have a dedicated video just for you. Check out our video titled Vitamin K Deficiency, Everything You Need to Know. Click the link in the description as it covers all the essential information and provides comprehensive insights into this important health concern. Don't forget to subscribe and click the notification icon to stay updated. Thanks for watching, and we'll see you on the journey to wellness.